I'm Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. As most of you know, May is Maternal Mental Health Month, and we are talking about mood disorders during and after pregnancy. It is my pleasure to interview Dr. Marlene Freeman, an expert on perinatal mood disorders. Welcome, Dr. Freeman.
Thank you for having me.
My first question would be, what would you say is the difference between postpartum blues and actual postpartum depression?
The postpartum blues is part of the typical normal experience. So, the majority of women will experience some mild and transient symptoms that do not interfere with functioning, but may include some mood symptoms, such as moments of feeling sad, overwhelmed, tearfulness. But the key is that the blues is transient and short-lived, and there may be a hormonal component postpartum to that. There may be a sleep deprivation component, but many women will experience some symptoms, and it is important to distinguish from postpartum depression. So it is possible that some women will have a slower onset of postpartum depression. Whenever women have mood symptoms, we want to really carefully monitor. But a postpartum depression is the experience of a major depressive episode that occurs in the postpartum. And there's a lot of heterogeneity to that, like exactly when the onset is, what symptoms women have. But the severity does meet criteria for a major depressive episode. So women may have a lot of the classic symptoms of depression that interfere with functioning, may affect self-esteem, may affect her ability to function as a new mother. So those are major factors that we look for to distinguish depression from the blues. So if a woman is having more mild symptoms, but is still functioning well, is bonding with her baby, what we want to do is make sure that we emphasize to women that she receives support and that she engages in self-care and is monitored to make sure that it's not the beginning of a depressive episode. But for most women, it will not turn into a depressive episode. But what we really want to make sure and be so vigilant about is to catch postpartum depression and catch it as early as possible.
With that, what would you say is the prevalence of postpartum depression, or PPD, and the prevalence of postpartum anxiety?
The prevalence of postpartum depression is usually cited as around 10 to 15% of new mothers, with some spectrum of severity there. But in some at risk populations, it's even higher. Regarding the prevalence of postpartum anxiety is a great topic. So I think overall, we've done a better job to educate healthcare providers and the public about postpartum depression. But postpartum anxiety is incredibly common and can occur comorbid with postpartum depression, but also can occur on its own. And for postpartum anxiety, in terms of a more generalized anxiety, just like there would be a spectrum of mood symptoms, there can be a spectrum of anxiety, but there is an increased risk of new onset anxiety disorders in the postpartum and recurrence of anxiety disorders in women who've had them before in the postpartum. So the postpartum appears to be an incredibly vulnerable time for women in terms of anxiety. So regarding postpartum depression, many women will actually state that what's bothering them the most, and sometimes what brings them to attention, is anxiety rather than depression because it can be so prominent and overwhelming. So, postpartum depression occurs more commonly with anxiety than depression outside the postpartum. And we know that for major depression in general, anxiety is highly comorbid, but it's even more common among women in the postpartum. So, that can take different forms. It can be excessive worry about many things, often focused on the baby. It can be panic attacks. It can very often be obsessive symptoms. So many women experience OCD symptoms, particularly obsessions. And those can be extremely frightening. They are often, very much like textbook obsession. So intrusive, recurrent, distressing thoughts that don't make sense to the mother, but she cannot stop having them. And most women don't know what they are. And very often they do take context around the baby. So maybe the baby's health and concerns about that. And some women will even have obsessions about harming the baby, which can be incredibly distressing to women and frightening when those are experienced.
That's very good information. And I think that's true that there seems to be so much more of an emphasis on PPD and much greater awareness of that, and much less so on postpartum anxiety. So I think that's very important to address. So you would say that these rates definitely would change if there is a history of anxiety or depression prior to pregnancy. Is that correct?
Any woman who has a history of depression or anxiety is going to be more vulnerable in the postpartum.
Right. And how can new mothers tell the difference between just sort of normal anxiety from becoming a new parent, perhaps if this is their first child, the difference between that and postpartum anxiety? What would be some of the signs to look for?
That is such an excellent question because, of course, especially having a new baby for the first time, it's really a daunting and challenging, life changing event. And for most new mothers, and I would say new fathers too, it would be normal to experience some anxiety within the range of a normal but major life experience. So it would be normal to worry about some things, say concerns about how the baby's been cared for, if the baby's behavior is normal, like is the baby eating enough is a very common worry. So some worry, some level of worry is totally normal. And it's very important for new parents that they get support and reassurance and they have individuals like pediatricians or relatives or mom groups to be able to ask questions to because it is such a challenging and new experience. But when we start worrying about levels of anxiety in terms of a disorder, it would be to a level that interferes with functioning. So while it might be normal to have some worry about the baby and the baby's care, it would be concerning if a mother couldn't sleep at all because she was so worried about the baby, or wouldn't allow someone else to help care for the baby because she was so worried. We're also very concerned about a clinical level of anxiety or depression if there are any problems with the mother bonding with the baby. So, what we often ask patients is, are they able to enjoy their baby? And that doesn't mean they have to enjoy every moment because it's so exhausting being a new parent. But we want to make sure that women are enjoying their babies some of the times, that they're having an overall good postpartum experience, even though it is so difficult. And if women are not able to experience that bonding and pleasure taking care of their new baby, then we're very concerned.
We know that sleep obviously impacts our moods. How can new mothers tell the difference between just simple mood alterations due to sleep deprivation and actually having postpartum depression?
In our program, I think that we really feel that sleep deprivation is one of the least emphasized variables in terms of maternal wellness and potential for becoming ill. So, if any of the listeners have not had babies, it is an extremely challenging task to take care of a new baby. New babies generally need to eat every 1 or 2 hours in the beginning. It takes a while to feed a new baby, maybe up to a half hour to feed the baby, then change diapers. The baby's up for a while and then goes back to sleep. But every 1 or 2 hours is not uncommon in the beginning. And it can be months before new parents are getting any real consecutive sleep. So in the beginning, sleep deprivation is the norm. Now, one aspect of this that really contributes is the emphasis on breastfeeding. So, if a woman is exclusively breastfeeding from the breast, that means nobody else can help with those nighttime feedings, and she's virtually never going to get any consecutive sleep. So, we know that many of our patients are sensitive to sleep deprivation, and some consecutive sleep can make all the difference between someone being well or someone being very ill. That's particularly true in women with bipolar disorder, but not exclusive to bipolar disorder. So, some consecutive sleep is important for most of us, and even if it's a modest amount of consecutive sleep. So, what we usually do is encourage patients, if they're going to be breastfeeding, to either pump or supplement with formula, but to introduce bottles so that someone else, ideally the partner, can give some feeding so that the woman can put together some consecutive sleep at night, because the accumulation of sleep deprivation can really be profound. So, for many women, getting some consecutive sleep can be a really important part of recovery.
Now, if someone is diagnosed with postpartum depression or postpartum anxiety, how long are these symptoms expected to last?
There haven't been a lot of studies to look at the duration of illness if untreated. The studies that we do have suggest that these can be long occurring disorders. So, probably similar to major depressive episodes that are not treated, if a woman has postpartum depression that's untreated, it's not uncommon that it can, like at a year out, a woman can still be depressed. So, we not only worry about depression in the acute postpartum period, but also throughout the first couple years. And there was a study several years ago that was published in a pediatric journal that showed that women of young children very often have major depressive disorder that's untreated really throughout those toddler years. So we do focus a lot on postpartum depression, but we know that mothers are at risk. And so we want to make sure that we're also focusing on maternal depression. But if it's not treated, it can often be long lasting.
That's a really good point to make because I think that sometimes new mothers, if they don't realize how long lasting those symptoms can be, especially if untreated, they think, well, they shouldn't be feeling this way any longer now that their child's in the toddler stage. But I think you address a really important point.
Well, one thing that makes the postpartum period unique in terms of context is how overwhelming it can be. So, women are generally extremely exhausted, busy caring for their baby, may not initially recognize symptoms of depression and anxiety and seek help. But we also find that many women feel guilty about having postpartum depression or anxiety and feel guilty seeking help. So, there's the stigma that occurs with psychiatric disorders in general, but very often women feel badly about not being happy in the postpartum. And they also often feel badly about taking time away from a new baby or other children to seek help, or feel badly about using family resources to seek help as well. So, very often, what we want to do is really ally with new mothers around how important it is to take care of themselves, because taking good care of themselves affects their children. And so, it's really an investment in the whole family's wellness for a mother to seek help. And so, of course, we wish that all new mothers would take good care of themselves because they're worth it, but very often we need to explain how important it is for their babies and children as well.
That brings me to my next question, which is if someone knows that they are at high risk, say they have a history of depression and anxiety prior to pregnancy, how soon in the perinatal period would you recommend treatment? And if there is an onset of new symptoms and they didn't have a history of anxiety and depression, do those symptoms vary depending on the trimester of pregnancy?
That is such an excellent question. I think really gets at the heterogeneity of perinatal psychiatric disorders and mood disorders. So, very often we hear about postpartum depression, and many people assume it refers to one thing. And there really are sort of different forms and courses of illness. So, some women will not have a history previously of a psychiatric disorder and become suddenly depressed or anxious in the postpartum soon after childbirth. But many women have experienced psychiatric disorders before. They've either had chronic or recurrent illness, and they experience illness in the postpartum. And then very often women will have symptoms that start during pregnancy, and typically, if not treated, those tend to worsen in the postpartum. So there are different sort of trajectories. And then, within postpartum depression, there are different symptoms that may be more prominent for some women compared to others. So there's a spectrum of severity, there's a spectrum of symptoms, just as there is with major depressive disorder. So, in terms of women who've had psychiatric disorders in the past, the ideal would be to start meeting during pregnancy, even if she's doing well, to make sure that there's a good plan in place for the postpartum. And it's really ideal to have a partner or another family member at those sessions to make sure that there's a team approach to postpartum wellness and monitoring. So, if a woman has had a history of depression, we want to make sure that she knows what to look for in terms of worrisome depressive symptoms. But we also want to make sure that partners are informed as well. So, as we were talking about earlier, it can be tricky to distinguish what is normal and difficult in the postpartum period versus when someone should seek help immediately. So, the more educated those around the woman are, the more helpful they can be to her. Also, for women who've had serious psychiatric illness, it really makes sense to have a very close monitoring plan in place and a plan for medication if needed.
Right. And we're going to get to that in just a minute. medications during and after pregnancy. But first, I wanted to ask you, how does untreated postpartum depression and postpartum anxiety affect the family and the children?
We know that having a mother who's depressed or anxious in the postpartum can affect the child almost globally. So, mothers who are anxious or depressed have difficulty bonding. Babies may have different sort of stress responses if the mom is depressed or anxious. Longer term, there are neurodevelopmental differences where kids seem to lag in terms of some neurodevelopment and how they do on different tests that measure some of that. Kids with depressed moms are more likely to have behavioral problems, more difficulty in school. So, really, having a depressed mother in the postpartum and during childhood is a risk factor for many problems in the children.
So, what are some evidence based treatments that can help?
So, psychotherapies and antidepressants are both first line treatments. So, for many, there have been certain psychotherapies that have been rigorously studied, including interpersonal therapy and cognitive behavioral therapy. There are studies that show different types of supportive therapies are helpful. And these have been studied and they're implemented in the community as individual therapies or group therapies. So it would be extremely unusual. I can't really think of a situation where we wouldn't recommend some type of psychotherapy to a new mother who is experiencing postpartum depression. So it's really important because it is such a major life transition and there are so many emotions involved. And so it is really an important part of the treatment plan. For women who have more mild depression, it may be sufficient to engage in psychotherapy. That may be all a patient needs, but for many of our patients, medication is an important part of her treatment regimen. So we have the most study, both in terms of the treatment of postpartum depression and in terms of breastfeeding information with SSRI antidepressants. And so very often, if a woman has not been on an antidepressant before, an SSRI would be the first medication that would be turned to.
And I know that new mothers are often very hesitant to take medications, especially during the pregnancy, during the perinatal period, but also during breastfeeding. What types of medications out there would you say are now? There's been enough research that's been done that they're considered safe for breastfeeding. And where would new mothers be able to find this information? Is this something that they simply have to turn to their doctor for, or how could they obtain more information about just in general medications?
Regarding the medications that have been most used and most studied, SSRIs are among the best studied medications in pregnancy and breastfeeding across all fields of medicine. We have a lot of study now, and the way we get good information about the use of medications and safety during breastfeeding is from mom baby pair studies, where the amount of exposure via breast milk or baby's blood levels is quantified in rigorous studies to look at that. And there have been now a good number of those with SSRIs and SNRIs. And antidepressants are considered compatible during breastfeeding. So there are some that we have more information about than others. Again, the SSRIs are probably the best studied and very often the first choice. So, for example, sertraline has had a lot of study in terms of breastfeeding. So, if a mother has never been on an antidepressant before, very often that's the first choice. What we also find, though, is for many of our patients who've had more recurrent or treatment resistant depression, even if they are on or have been on in the past an antidepressant that's not as well known in breastfeeding, but it's clearly been the best medicine for them, we would still consider it in the context of breastfeeding because it's so imperative for women with postpartum depression to get well as quickly as possible. And it really is not a good time to have medication trials of brand new medicines that a woman hasn't tried and may need to be on for several weeks before she knows if they work for her or not. So, typically and importantly, if a woman's been on a medication during pregnancy, we recommend that she maintain the same medication in the postpartum. So, the baby would have already been exposed during pregnancy, would be exposed at a lower rate during breastfeeding. And as clinicians know, these medicines just aren't interchangeable for patients. So, somebody may respond well to one and not another. In terms of where to find the information, so, there's some variability how comfortable primary care doctors are, OBGYNs, midwives, lactation consultants about the use of antidepressants in breastfeeding. I think that many primary care doctors and OBs are really excellent and up to speed in terms of supporting women around getting treatment, but there are also online resources. So there's a website, mothertobaby.org, there's LactMed, and a very important resource for women and clinicians to know about is Postpartum Support International, which has a website which can link women with healthcare providers in their geographic area. So not only is there general information about postpartum disorders, but there's also connections to warm lines in someone's local area and connections in terms of how to find providers.
That's excellent information. Thank you for sharing that. And along the lines of, new mothers being a little bit concerned about medications, what would you say are some of the most effective non-pharmacological treatments and also complementary treatments available? I believe you've shared some data on omega-3s. What would be some of these alternative treatments that could help or additional treatments that could help?
Absolutely. The most important non medication treatment is psychotherapy. And so we really want to emphasize that if a woman is not open to taking medication in the beginning, that she does seek psychotherapy. In terms of the more complementary and alternative treatments, there is some evidence for an antidepressant effect of exercise in the postpartum. There have been some studies looking at omega-3 fatty acids that generally don't show a benefit in randomized controlled trials for postpartum depression. So in perinatal depression, there have been a number of studies looking at acute treatment and looking at possible prevention of postpartum depression. And there was one robust study of omega-3 fatty acids for depression during pregnancy that was a randomized controlled trial, but there have been two that have been negative, and then there have been a number for the prevention of postpartum depression that have not shown a benefit of omega-3 fatty acids. So omega-3 fatty acids may have some health benefits for pregnancy, but we don't want to count on omega-3 fatty acids for their antidepressant effect. In general, in psychiatry, the role that omega-3 fatty acids seem to play in terms of the evidence base is an augmentation strategy for depression. So they may have some antidepressant effect, but in general, that's been demonstrated as an augmentation of standard antidepressants. And so typically that would be how they would be used during pregnancy and postpartum. But what's really interesting about omega-3 fatty acids in terms of pregnancy is that they appear to, in studies, to consistently and modestly lengthen gestational time, so that while they may not be the answer to prematurity, they may provide, some benefit in terms of lengthening gestation in women that tend to be at risk of complications. So there may be, some buffer in terms of prematurity with omega-3 fatty acids. There have also been some studies looking at light therapy, but primarily in pregnancy versus postpartum. Also been some studies of acupuncture that have shown some benefit, but again, those are primarily during pregnancy compared to postpartum.
Are there any studies that have examined whether breastfeeding alone reduces symptoms of postpartum depression or postpartum anxiety?
There have been studies that look at the relationship between depression and anxiety and breastfeeding that generally haven't shown consistent patterns, but it's probably a very complicated topic. So clinically, it really looks like the relationship between breastfeeding and postpartum depression and anxiety, they have bidirectional effects. So if a woman is more stressed or depressed or anxious, it may be more difficult to breastfeed. And if a woman is having difficulty breastfeeding, it may trigger some anxiety and mood symptoms and be a trigger for even a depressive episode if she's vulnerable to experiencing one. So it is a very complicated topic. And I do have to say that in my career in women's mental health, the topic I've seen the most distress and tears around is the topic of breastfeeding, because many women feel like they're failing as a mother if they're having difficulty breastfeeding, because it's such an important part of taking care of a new baby, how a baby is fed, and so much time is spent doing feedings. But it's really important that we support women around trying to breastfeed and also around not breastfeeding if it's not the right thing for them to be doing, if they're too distressed by it, or the sleep deprivation is too great, or they're just having difficulties with it and it's not going well, that We have to remind patients that it's okay to bottle feed, that there's a lot of pressure on women right now to breastfeed. And from a public health perspective, breastfeeding is best. And that message is out there loud and clear. But for each individual woman, it might not be the best thing for her. So we just have to make sure that we're assessing that in an individual way, because for some women, the difficulties that they engage with breastfeeding can make a very big difference in terms of their wellness in the postpartum.
Right. Would you say that there's lower rates of these disorders in communities where a lot of people try to help out with new parents in the beginning?
It does look like support is helpful, and it looks like not having support is a major risk factor for experiencing postpartum depression. So it definitely does look to be the case.
I just have one more question for you. Do new fathers suffer from similar issues too? Do they suffer from sort of postpartum anxiety and or depression?
Yes, fathers are not immune from this. One of the bigger risk factors of new fathers having quote unquote a postpartum depression is if the mother is experiencing depression. But for fathers, it is also a major life changing experience. There's a lot of responsibilities that come along with new parenthood. And fathers are vulnerable as well. And there have been some studies that look at rates of depression among new fathers and show that there is an increased rate of depressive symptoms. So it's definitely the case that for new fathers, it can be a vulnerable period as well.
Wow, so interesting. Well, thank you so much, Dr. Freeman, for joining us.
Thank you.
And thank you all for tuning in to this episode of the NEI podcast.
This podcast was brought to you by NEI membership. You're busy caring for your patients, and you might not have time to keep up with the ever-changing treatments in mental health care. You don't have to. NEI membership includes regular psychiatric news updates, CME activities on the hottest topics, and the most cutting-edge prescribing app available today. To learn more, visit the link provided in the podcast description.